Chair now recognizes the gentleman from Georgia for 5 minutes.
Thank you, Mr. Chairman, and I appreciate you letting me sit in on this. Thank all of you for being here. You have a very important job, and certainly it's very important to consumers. Full disclosure, currently I'm the only pharmacist serving in Congress for over 30 years. I practiced in retail pharmacy, and I'm very familiar with what's going on in that. And I wanted to ask you, I want to talk specifically about PBMs, pharmacy benefit managers, where 3 companies control 78% of the market. First of all, Mr. Simmons, you and I met after you became director, and we met and we talked about the anti-competitive nature of this. Would you consider 3 companies owning 78% of the market to be a problem?
That's certainly a market structure in which you might find and we might look for anti-competitive conduct. As I mentioned before, in terms of antitrust enforcement, the places you look are the places where there are small numbers of firms with large shares.
Right.
And this would be such
One of the things that confuses me is when we talk about vertical integration and horizontal integration, and oftentimes you tell me, well, vertical integration's fine. And we just have to worry about horizontal integration.
No,
well,
I wouldn't say that.
Well, I appreciate you correcting me, because that's probably a misnomer that I want to dispose of, because the vertical integration as we see it right now, all of you know what's going on. All of you know what's going on. We've got the top 3, those 3 that I mentioned, PBMs, that control 78% of the market. You got CVS Caremark that now is buying Aetna. So all of a sudden, you're going to have a vertical integration that includes the insurance company owning the pharmacy benefits manager, owning the pharmacy. Now you've got Cigna buying out Express Scripts. Did you know that Express Scripts, according to volume, is the 3rd largest pharmacy chain in America right now? So now you've got number 1 at CVS, you've got number 3 at Express Scripts. Cigna's going to be the insurance company. Express Scripts will be the PBM, and they'll be the pharmacy. In that vertical integration, you yourself, Mr. Simmons, the FTC investigated in January of 2012 regarding patient steering from Caremark to CVS and what was going on there. We see it. I've got numerous examples that I can share with you, and I will be glad to share with you. And yet they hide under the auspices of a lack of transparency. I mean, this is the most opaque system that's known out there. The most opaque system, because, and they hide behind that, and their profits have been just outrageous. In fact, I don't like to read, but I'm going to read this. According to data from CMS, between 1987, when PBMs first became involved in this, when they were formed, and 2014, expenditures on prescription drugs have jumped by 1,100%. There's been a 1,553% increase in per-employee prescription drug benefit costs since 1987. In the last 10 years, the 2 largest PBMs have increased their profit margins by nearly 600%. Now, folks, I'm not opposed to anybody making money. But if you ask them, what is your mission? What is the mission of a PBM? They'll tell you it's to control prescription drug prices. Well, how's that working out? Why is that an initiative of the President of Health and Human Services right now to lower prescription drug prices, if they are fulfilling their mission? And yet they're hiding again, and this is what we look to the FTC to do. Am I wrong? Is that not your responsibility? Should I be talking to some other agency?
Well, it's partially our responsibility. So we look at anti-competitive conduct, and if they're engaged in anti-competitive conduct, we should be challenging it.
So I had, just a quick story. I had a pharmacist that shared a story with me that he filled a prescription at his drugstore for his wife, who was covered under Caremark insurance. That night, he got a call at his home from CVS saying, if you get it filled at our pharmacy, you can get a lower copayment. Now, is there supposed to be a firewall? What happened to that firewall? This was his wife.
I understand.
That's the kind of behavior that's going on here, and we look to you to help us with this, not because of the pharmacy, but because of the consumer. It's the consumer who's suffering here. Because as you do away with the independent retail pharmacies, you do away with choice, less competition, that's not going to benefit the consumer at all. it's just very frustrating when you have a profession where the PBMs are responsible. They create the pharmacy networks. They decide who's going to be let into that network and who's not going to be let into that network. They direct the patients to the certain pharmacies, and if they own the pharmacy, who do you think they're going to direct it to? My one question is, who's supposed to be watching this? I thought it was the FTC. Can I get a commitment that you'll look into this?
We are looking into it.
You're looking into it now.
You and I had a meeting, and
we did.
And I took what you said to heart.
Thank you. I look forward to continuing that conversation with you.
Thank you very much.
Thank you.
The gentleman's time has expired.